is everything I could tell you about my experience getting a hysterectomy as a trans man in about 3 minutes or less. So I had a full hysterectomy with bilateral salpingo-oophorectomy, which is basically a fancy way of saying they took everything out. And the reason for that being is because I was going to have phalloplasty, did have phalloplasty. And for me personally, they scraped the walls and sewed me shut, if you know what I mean.
I believe the technical term here is jack-o'-lanterning.
Yes, you may ask. Thank you very much. In a vaginectomy, they go through the vagina in order to make incisions along the wall of the vagina and remove it entirely. I personally like to refer to it as jack-o'-lanterning, but I think that might be a little gruesome for others. It can prevent the vagina from secreting any fluids, and it also eliminates the need for any pap exams. The surgeon might close up the vagina itself, or it'll close up on its own over time. That's what mine did. You can also get it done at the same time as a hysterectomy, which was offered to me, but I didn't get it done at the same time because I didn't feel like I was ready for it yet, and that's perfectly fine. Thank you so much for your question.
So they had to make sure there was nothing left that could cause infection or whatnot. Worth noting, some guys that get phalloplasty end up leaving it open. It's just personal preference. Some people identify with those parts whereas I never did.
You came to terms with having an arm that you didn't feel like was yours. Why is this different? Why couldn't you come to terms with this?
So I wanted it gone. So for trans men, if you are on testosterone, doctors recommend that you get a hysterectomy within 5 years of starting hormones.
They're giving this testosterone to girls who are so young that they're apparently going to need the gender-affirming hysterectomy as a result of the testosterone use, possibly before they leave high school, if not college. How could they possibly consent to that? To the increased dementia risk that represents, for instance, when they're a minor?
For many reasons, as like many other transgender topics, they don't have enough research to know the lasting effects of hormones, testosterone on those parts.
We're doing it to kids. It's the healthy child sex lobotomy experiments. And they're going to get to find out. We're all going to learn a lot.
What they did seem to find so far, though, is that long-term testosterone use can cause painful cysts on the ovaries, which was true for me, which they found when I had my hysterectomy. I saw Dr. Monica Gomez. She was at the time at Brigham and Women's, and that caused a little dysphoria for me, you know, going there, getting a bracelet and everything. It was clear that I was a patient. There were other men there, but they only seemed to be there to support their wives, girlfriends, whatever.
Are we assuming genders here?
But she was awesome. She had already done like 300, I think she said, hysterectomies on trans men before me.
Leonidas' entire army was trans, it turns out.
This is Sparta!
Everything was completely laparoscopic. I could show you a picture if you'd like. It just left a little indent. There were 3 places that she went in, and one of them was through the belly buttons.
The wildest, scariest, best scream your lungs out ride in the world!
So you can't really even see anything. As for the recovery time, I believe she said I only needed a week or so off if I worked at a desk job, which I didn't, so I took a few weeks off. Very little pain. Everything was controlled with Tylenol and ibuprofen, I think. I think I switched off. And it was good to just walk a lot right from the get-go. I think I walked a little bit too much because about 2 weeks in, I went to the bathroom and there was blood. Kind of a lot of blood. It kind of reminded me of the start to when my menstrual cycle still happened. But I called the doctor. They said that's normal, moving around. Blood is still, you know, draining and leaving the body.
So there's a bit of a tasteless menstrual joke.
Well, I'm sorry, Wendy, but I just don't trust anything that bleeds for 5 days and doesn't die.
And it's a little crass, but like it comes from somewhere. Like it's funny for a reason. And the idea is like you're not supposed to bleed for 2 weeks straight. You're not supposed to be continuously bleeding. So the idea that blood would just still be draining, like why would it have stopped bleeding for 2 weeks and then started again if it was just some continuous blood draining from the original surgery? I had a significant bleed after about 2 weeks after my surgery for my Eagle syndrome, And it was it was something they warned me about. It was called a tonsillar bleed, and it was caused by the fact that these scabs that formed over the wounds eventually just kind of fell off. And when that happens, you can end up with bleeding. So there was abrupt bleeding, and I was just spitting into a bucket. And it was no fun. But I imagine something like that happen where there had been a scab and the action of moving around caused it to break off and then cause the bleeding. But for the doctor to suggest that she's somehow just like a bag of blood that's just been steadily draining for 2 weeks from what was that?
So it really wasn't bad. I was eating very healthy at the time, I believe a vegan diet, and I just healed really quickly, and yeah, like I said, very minimal pain. It wasn't bad. Also, I had my histo in 2018, which means I was a little over 6 years on testosterone at the time of it. So I put it off because it didn't matter to me at the start to my transition, because I just wanted to appear as the man that I felt inside. That's what mattered to me the most. But it did feel good to have it done, and I felt like, I don't know, I just felt lighter inside. I felt like, I don't know how to really explain it, but when you're on testosterone and your body is still producing estrogen, they're like constantly at war. So that wasn't happening anymore, and I just felt better knowing that that was all gone. But yeah, if you have any more questions, drop them in the comments. Much love.
Some women really struggle with the effects of estrogen and may transition and take any of the wide variety of hormones they give to people who are medically transitioning to do all sorts of things in the body, including lower the body's estrogen level and disrupt the cycling of estrogen and progesterone without actually introducing testosterone into the system as well. And so that's just kind of a common thing for women that identify as trans to feel like a lot of the relief can correlate to the reduction in estrogen, which suggests that perhaps there's a real hormonal situation, hormonal, like an endocrine psychiatric situation, interaction that could be medically addressed in some other way that didn't create all these complications